Thank you all for having me. Flu certainly has no borders, whether we're talking about Louisiana, Maryland, and as you all have seen, it has been a very severe flu season for the United States. We were one of the first states to be categorized as having widespread flu. There isn't anything unique about Louisiana that gave us that honor. I want to say that it was partly because of our very strong surveillance systems. We have a very rich collaboration with our primary care partners, our emergency departments. So once we had the initial cases of the flu, we were able to start documenting, sharing, and again, we were been in the midst of this for about 2 months. The challenge this year is that many people are getting ill, more in terms of numbers, and also more in terms of severity. So I appreciate the fact that I am here to be able to share some of the key prevention messages about the flu. Some of them are the same ones you always hear about: staying home when you're sick, making sure that if you are ill, you are preventing that illness, does not spread to others. So whether you're talking about a school child or someone who has to go to work, trying to make the best decision to prevent other individuals from getting sick. Reminding people that the flu vaccine is still the most effective form of prevention. We've talked a little bit in various channels over the last few weeks, the fact that the vaccine may not be as efficacious as it has been in the past, but it's still the single most effective form of prevention for all of those who are able to receive it. And who are those who are able to receive it 6 months and above, and those who obviously don't have a major allergic reaction. So the flu vaccine is something that we're pushing, and we'll talk about our statewide campaign last week. And then also, given the fact that we are having a fairly severe flu season, we've gotten reports from hospitals and ERs saying there's a lot of people in our waiting room who don't necessarily have to be sitting there for hours waiting to be assessed for or evaluated for flu symptoms, or waiting there to get a Tamiflu prescription. So reminding our public that if possible, we want to save the ER and the capabilities of hospitals for those who have much more acute symptoms, perhaps those that are having trouble, difficulty breathing, those who are having chest pain, those who are really dehydrated, those who are having symptoms that's beyond the usual flu, and directing those individuals who need primary care level work to be either contact their doctor, or if it's after hours, perhaps go to an urgent care. So this is really a call to make sure that during these times where we have a very high number of ill individuals in the state, people are directed to the most effective place for care. So again, thank you for that introduction. In my role as Assistant Secretary for the Office of Public Health, there are many duties. One of the core functions of the Office of Public Health, of course, is the prevention of infectious diseases and the control of communicable diseases. So once we identify it, once we find that source, we're able to contain it and limit its spread. You all have heard about our responses over the last year. We had a fairly large mumps outbreak here in the state. The tools that we use to address mumps, or the tools that we use to address even TB, the cornerstone principles and how we apply it to flu are the same. Identify those who are ill, make sure they're able to get treatment, and identify those around them who are not yet ill, and make sure they know what steps they can take to prevent themselves from becoming ill. And in a lot of cases, when we're talking about vaccine preventable diseases like the flu, like the mumps, we want to make sure that those individuals have received the vaccine. It's usually very cost effective. It actually is the most cost effective form of prevention. There's safety measures that have been studied for many, many years, and I'm sure we'll get some questions about the safety of vaccines a little later. And then again, just informing the public how various diseases may be transmitted. And with the flu, as you all know, it's transmitted by droplets. So when someone coughs, when someone sneezes, they produce droplets through their secretions of the mouth. And those droplets, sometimes very small, can travel several feet. We usually talk about 6 feet. So when we say avoid close contact, you want to, if you're ill, avoid being in very close proximity to individuals. But if someone's even sitting 12 feet away and I have a really good cough, really good sneeze, it does not mean that my droplets cannot project across the room. So there isn't necessarily any safe distance. And so oftentimes we say when you're sick, it's just best to stay away from everybody. Isolate yourself to a particular room in the house, avoid contact with others, and realize that when you're most infectious could be in those very, very first days of your illness. So it's when you're starting to feel really ill, you're at work and you're like thinking, oh man, I just got hit by a Met truck. I'm getting the high fevers, the chills, I better go home. At that point, you're highly infectious. So, you got to do what you can once you realize that you're potentially ill to be able to isolate yourself from others. But once you know you're ill, what we recommend is that people stay home for at least 24 hours until they're fever-free. And of course, that's without the use of medications such as Tylenol or other antipyretics, because if you're taking that medication to reduce your fever, you're just reducing your fever. You're not actually over your illness. So it's important to stay home. Don't go to work or school when you're ill. Sounds very simple, but when it comes down to public health principles and dealing with everyday diseases like the flu, it often is those very simple prevention messages that will go the longest of ways. So we've heard again about some preventive measures covering your cough, thinking back to your kindergarten basics, washing your hands. That's a cornerstone when I talk about the functions of public health in all sorts of disease prevention. When we're talking about foodborne illnesses, we say wash your hands. When we're talking about infectious diseases, we talk wash your hands. And of course, with the flu, as I mentioned, the droplets can enter someone's body either through breathing, so through your mouth, or potentially if you are near someone who's coughing and has the flu and the droplets get on your hands and you touch your eyes and you touch your nose, there's potential another way of entry into the body. We want to avoid being around people who are particularly vulnerable to infections, respiratory infections. And who am I talking about? Oftentimes the elderly. So if you're ill, it's not wise to go and visit your loved one in a nursing home where everyone there may potentially be somewhat immune compromised. And they're all at a high risk because why? They're all at close quarters. So thinking back again, I'm going to throw other analogies like the mumps where we saw it was in a university-based setting. It's a high-risk setting. Those university students are some of the healthiest folks there are, but because they were so close together, the disease was able to spread quickly. So it's the same exact concept when you're talking about a nursing home where there are many folks who probably don't have the same baseline health, are basically in close quarters. And so if one person becomes ill, it's very easy for that to spread. So it's really important to think about when you are ill to avoid visiting individuals in a nursing home and even in the acute care facilities. You'll see signs in local hospitals where they ask individuals if you have the flu to please consider not visiting, and if you must, to wear a mask. And again, we talked about when it's safe to go out into the public. That's when you're 24 hours fever-free. One of the things that we've talked about a little bit more this year than in the past, in addition to getting your vaccinations, is the use of antiviral medications. And so we've heard, the common names, Tamiflu, Influenza. These are medications that are able to slow down the infection in your body. So a lot of times we say when you have viruses, unlike a bacterial infection, we don't have medications that kill the virus. In this case, too, those medications help prevent the spread of that virus or allow it to multiply in the body. So it doesn't kill the flu virus, but it's able to inhibit its spread through the body. So they're very effective in slowing down the illness. Many individuals who take those kinds of medications do not experience the severe symptoms, are often able to avoid complications from the illness. And there's also studies that show that the duration of the illness can be reduced by 1 to 2 days. So that may not sound like a lot in terms of 5 to 6 days being reduced by 1 to 2, but when you take any sort of a change and apply it on a population level, when you take that times the number of individuals who have the flu, let's say 8,000 individuals we're going to talk about that have maybe potentially hospitalized, and the tens of thousands of individuals who've had the flu this year in Louisiana, multiply those tens of thousands by 1 to 2 days, that's that many days less that we're spreading the flu. So it's not the cure-all and end-all, but certainly we're talking about those medications much more this season than we have in the past. So it's a good idea to call your doctor and see if those medications are appropriate for you. And I do believe they can be dosed for much younger children, and it can be dosed for those who have chronic diseases, issues with their kidneys, so that they could get the right amount of medication. I think one of the other things we probably want to talk about is it is a little bit late in the year in terms of thinking for some people for the flu season, but why is the Office of Public Health still pushing this? Well, the reason is, as we mentioned, this is a very severe flu season. If you look at our curve as a number of cases, we peaked about 2 weeks ago, and we're starting to come down, but still where we are right now is much higher than any of the peaks in the past previous flu seasons. So this has been the most intense, most severe since H1N1. We had a fairly severe season 3 or 4 years ago, but even right now in the early February, the number of people that are ill in Louisiana really is comparable to the highest levels of flu illness in the past previous years. And because so many of the states around us also have high levels of flu, and because we've got Mardi Gras coming, and we know we've got people coming in from other parts of the country, perhaps reintroducing it or being in close quarters once again, whether you're hosting family, friends, or out in the community, we wanted to make sure we do everything this year to ensure that people are catching beads and not the flu. And so we really thought it was important to go out and do this additional push. So last week on January 31st, we did a statewide flu campaign from 1 to 4:30 on January 31st. That's usually a training day, so we didn't cancel any clinics. Our family planning, our WIC clinics, our other immunization clinics, that's a training day that we asked our staff to give up and to go ahead and do vaccines for no cost. And the reason I say no cost versus free is that we do still bill our insurance providers, Medicaid, Medicare, but we don't charge that individual the copay or any additional fees because we want to encourage everybody to come and get this vaccine. We vaccinated over 2,800 individuals in one day. We had mass vaccination exercises, which are these days that usually before the flu season, each of the 9 public health regions, whether through their parish health units or through one community setting, bring all of their staff together and have people kind of line up through, get their vaccinations very quickly. And I can tell you, in the one day last week, we vaccinated more than all of the ones combined in the fall. Now, why was that the case? One, as you all probably know, and the reasons you all are here, is this is getting national attention. This is a very severe flu season. We were fortunate that we were getting a lot of press coverage both locally and nationally, and people knew that A, this is a serious issue, and 2, by doing a statewide campaign, many individuals who may have not have heard about this opportunity heard about it. And 3, what I realized as I was coming down from Shreveport that day, and I went through 2 health units, and I won't name the specific parishes, but in between, Shreveport and here, there's five different health units. Went into one just to see how it's going. And I saw a grandmother, say probably in her 60s, with her son who was probably in his 30s with 2 young children, both about 4 and 7 years of age. And I said, "What brought you here?" And she said, "Well, I heard through one of my friends that y'all were doing this and just wanted to come and make sure my children are protected." This is the grandma speaking, my children, including the grown adult son. And I said, had you heard about our exercises in previous to the flu? And she said, "Yeah, I heard about them, but it really makes a difference when we don't have to pay that additional $10 because I've got 4 people here and $40 is a big difference for us." And so, at the end of the day, when we have situations like this in public health where the health of that young child, whether she's in daycare, whether she's riding on the bus, whether she's out in a playground, or whether she's enjoying a birthday celebration, by protecting individuals' health, we ultimately protect the entire community. So when it comes down to what we're trying to do in the Office of Public Health is through these purchased vaccines that have been previously bought through federal grants, through dollars that were sitting in our supply, we decided to make the best use of them. And again, I'm very proud of the work that our staff did to accommodate, again, over 2,800 individuals, children, adults, elderly, and all the parish health units across the state to provide those vaccines. And I'll end on, because I know there'll be many questions, the kind of questions we often get about vaccines is, do I get sick do I get the flu from the flu vaccine? And the answer is no. You do not get the flu from the flu vaccine. But why do people think that? Let's think back to last Wednesday. So 2,800 people were vaccinated. I guarantee you of the 2,800 people, a couple of them last weekend probably had family or friends that were with them that had the flu, and they may have contracted the flu, and they're going to be ill today or tomorrow with the flu. And they may think the vaccine gave me the darn illness. But that's not the case. What happened? It takes about 1 to 2 weeks to develop immunity. So for the vaccine to work, to build up your immune system to prevent you from getting the flu. And they had already been exposed in that 2-week period, and they're going to have flu symptoms this week. And so they may think to themselves, I got the flu shot, and now I got the flu. So that's one way. The other way certainly could have been the person could have been exposed a couple days before. The other thing that we're hearing, as you guys are also saying, is there's different strains of the flu. Today there's comments about the dog flu, the bird flu, and there's different types of flu viruses that infect humans. So it's also theoretically possible for you to be vaccinated against one strain, but in your community a different strain may be circulating that you didn't get that protection from through the vaccine. And that's part of the larger problem with our national numbers, is that the strain of flu that's circulating now, the H3N2, has shifted its makeup. So its genetic makeup is slightly different, and the vaccine that we have is not able to fully protect everyone against the circulating strains. And that's always a possibility, and that's the very reason why it's so important to get your vaccines every year. Why do we come up with a new vaccine every year? Because that flu season is smart. It's Mother Nature. It's going to want to get its job as a virus, as an infectious agent, is to get into your body. Its whole evolution, its whole purpose is to get someone ill, so it gets into your body, it multiplies, and it spreads itself. And so flu viruses change a little bit every year. And so we try to outsmart it, bring the scientists, bring people together in early summer months, and try to predict what strains are going to be circulating the following year. And then they pick the top 3 and they put it in the vaccine, and in some cases the top 4. But sometimes our scientists are not able to predict exactly which virus it is, or that virus changes. And so those are things that can also happen, is that you can get the flu vaccine, but at the end of the day, you may be exposed to a different type of strain. So is it worth it? Is it worth the trouble? I say yes. Whether it's 30% effective, 40% effective, some of these lower numbers that we've heard, if you think about the nearly 2,800 people that we vaccinated, if we can protect 1,000 of them, that's less than 50%, 1,000 of them from becoming sick, and out of those, what numbers would potentially have gone to the hospital, potentially develop complications, and of them pass it on to their family and loved ones? You think about that multiplicative effect. Regardless of the varying efficacy, of course, the higher it is, the better it is for the public. Getting your flu shot is still the most effective form of prevention. So it's not too late to get the vaccine. We are extending our no-cost flu vaccine campaign through February 12th, given the resounding success and actually questions from many of the media as well about, is this just a one-day effort? So we wanted to see what kind of stocks we have, and it's very likely we may even go beyond that. But at this point, we want to assure the public across the state that we'll be providing no-cost flu vaccines at all the PHUs, public health units, through February 12th. Because we're not doing a one-day campaign and other patients are being seen during the days, we encourage everyone to contact that local public health unit to see what's the best time to go ahead and get that vaccine. And whether it's through public health, your retail pharmacy, your primary care doctor, it really doesn't matter. What we care in public health is that you get vaccinated. Let me stop there and see if there's any questions.
So questions should come from members of the media and members of the press club. Yeah, that's all I wanted to remind people. Thank you.
Yes, sir.
Which region, well, which parish is leading the state in terms of number of flu cases thus far?
I don't know if I can give you an exact number. I think in terms of, there's the absolute number. So when we got parishes that are highly populated, such as those in the New Orleans area or certainly East Baton Rouge, you're going to see higher numbers. But in terms of the rates, they vary. Each week, we produce a report through our infectious disease epidemiology section that shows the rate of spread. And so I actually have that map with me. I just don't particularly like quoting it because it changes from week to week. So, but what we have published is that there's widespread illness in certain parts of the state and regional spread. So I'll go ahead and hold it up where the red is the more severe and the orange is less severe. But just last week it was areas on the North Shore and other areas that had the red. So this is this week. What's important is that there's flu cases across Louisiana. And what's important is that, infectious diseases don't know borders. Infectious diseases go from one state to another, and so I wouldn't put too much value in this week's map, but that it is still widespread across Louisiana. And what's perhaps important nationally, as you all may have seen, it's widespread, I believe, in every state except Oregon and Hawaii. So for all intents and purposes, as a nation, we're at the peak of the flu season still. And I'll explain what this map is. So what that is we look at ILIs, influenza-like illness. If anybody walks into an ER, you don't know yet whether they have the flu. They may come in with a runny nose, a fever, a cough, and we're going to classify it as an influenza-like illness. Now, it may wind up being another virus, like cold virus or other ones like adenovirus, rhinovirus, enteroviruses, a number of other viruses that can produce the same type of illness. But generally, we've seen that just looking at that holistic measure, that seems to approximate the flu intensity as well. So a couple weeks ago, we had reached nearly 11%. So I will hold up another map, perhaps, and so you'll see the epidemic curve. This is when I say we're starting to trail down in terms of the number of cases, and this is a public document I'm more than willing to share with anyone who'd like it, a copy, is that we are beginning to trend downwards. In the previous seasons, when you look at the influenza-like illness percentages, our peaks have been at 8%, 6%. This year, we shot up all the way to 11%. So even though today we're down to 8% is still higher than what we've been previously in our peaks. So this influenza-like illness just gives us a sense of level of intensity, even though the numbers are slightly going downwards. The fact that we are still in the middle of a national epidemic, and the fact that so many individuals in Louisiana still are experiencing the signs and symptoms of the flu, we want to go ahead and make sure people hear the messages about prevention and go ahead and get vaccinated if they haven't been yet vaccinated. Yes, ma'am.
Is there any threat of a shortage of any kind of antiviral or the vaccine itself? Some folks are saying they're going to a pharmacy and they're telling them they're out.
So, good question. You may be out, but is that because of a shortage? Is that because they have already exhausted the supply that they had? I can tell you from the Office of Public Health, we have plenty of doses. We have over 7,000 available right now, another 2.5 in immediate supply. So I can guarantee you from the Office of Public Health perspective that we have plenty of doses. Again, I can't speak on behalf of the private providers or the retail pharmacies, but we have not had any reports of shortages of the influenza vaccine. When it comes to the antiviral medications, we had gotten reports of certain locations where there had been a small outbreak in the community, so that retail pharmacy had exhausted its supply. But I can tell you that a lot of them have gone and replenished. And so you may find pockets of it, but when you look across a region, if one store may not have it, it shouldn't be very hard to find here in Louisiana. So at this point, we shouldn't allow limitations on either the vaccine or the Tamiflu or other medications to be a limiting factor for us. Yes, ma'am.
I think you touched on it a little. I don't know how to pronounce it, but I think it's adenovirus, you said? Adenovirus?
Other viruses, right.
And they say it looks like the flu, acts like the flu, but it's not technically flu. Is that something that we should be, cautious about, especially in Louisiana? There have been reports about people throughout the country being affected by this. And are there any vaccines for the adenovirus as well?
Nothing like we do for the flu. So the other viruses that you're going to hear, adenovirus, the coronavirus, even the parainfluenza virus, and then for children you sometimes hear about RSV, excuse me. And so the reason we bring those up is that many a times, those can be diagnosed as well through appropriate testing. It's just that we have had a fair number of cases and individuals becoming confused as, well, I got the flu vaccine, why am I still getting ill? Or the Tamiflu may not work as well against some of those other viruses unless it be prescribed. So it's important from a diagnostic standpoint to be able to identify what's the causative agent of the illness. Usually we don't see the number of hospitalization and deaths from many of the other types of viruses like we see with the flu. So the flu is still kind of public health enemy number one when we talk about implications. However, we have seen and we are hearing that the adenovirus and some of the other strains have also picked up this season. So I think from an academic standpoint, a public health standpoint, it'll be important to go back and revisit these numbers so we can learn from it and apply for future lessons. At this point, you know, those basic prevention messages, whether you have the flu or adenovirus or coronavirus, if you're sick, stay home. Don't send your children to school. And then again, try to contact your primary care provider, even for those types of illnesses, unless you have very serious chronic conditions or are really developing signs and symptoms such as shortness of breath, heaviness in the chest, and those other things from going from the ER. So there's many lessons to be taken away from our flu prevention messages for those other viruses as well. Yes, sir.
We live in an age of social media where ignorance spreads faster than the flu. You alluded to the fears that some people may have basically about vaccines. Is that an issue that y'all have addressed?
You know, from a public health standpoint, we stand by the fact that vaccines are the most effective form of prevention. It is, with the flu vaccine and many other types, we have years and years of data to support the recommendation that the vaccines are still the most safe and effective form of prevention. You know, we had heard many falsehoods through the last couple decades, and there's been many published journals and articles that have come back and verified that those findings that had been claimed were not in fact true. I'm going to give you a very clear example, kind of along the lines of, hey, I got the flu shot and then I got ill. You know, of the 2,800 people that got vaccinated last week, one person could very well have experienced another adverse health outcome, could have had a heart attack over the weekend. Someone could have potentially had another health condition, and in their mind, they're going to associate that event with the vaccinations. If you apply that on a national level, of all the people that got vaccinated, and enough people come and say, you know what, my father had a heart attack 3 days later. My grandmother had a heart attack 4 days later, and you start finding these individual pockets and they come together, and there's this association, not causation, association of time and when they had received the vaccine, and they come together and they say, in our minds, we believe that the flu vaccine had caused this adverse effect. There's no way that any science or data is going to change those people's mind. So what we can say in public health is repeat the data that we have, that's population driven, that's done across many countries to share our message. So again, the vaccinations for the flu, again, some individuals are going to feel a little soreness. Some people may in fact feel like they have the flu, and what's happening there is the vaccine is eliciting that immune response. It's tricking the body into thinking you're sick. So you may even have a slight temperature. You may not really feel like you have all the energy. That's exactly what the vaccine's intended to do, to make you feel like that, so your body's immune system builds up. So when you do actually encounter the actual virus, your body has built some immunity. So explaining those kinds of things, I think, is important to our residents, so they understand what they're dealing with, and wherever possible, we certainly provide whatever education we can to remind people of the safety of the vaccine. Again, no one intervention is 100%, is 100% safe. So is there a possibility of an allergic reaction? Yes. Is there a possibility of someone having what we call often an adverse health reaction? Yes. So it's important to make sure when you get the vaccine, if there are any underlying conditions, allergies, you share that with your provider, and they can either say, you know what, the vaccine may not be the best option for you, or to be prepared to be able to treat you in case there are other sorts of outcomes. Again, nothing is 100% safe, but getting the flu vaccine or any other sort of vaccine still winds up being the most effective form of prevention. Yes, ma'am.
We've heard a lot about the deaths around the country, and I think that people are already scared with that. Can you talk a little bit about how it gets to that level and just kind of alleviate people's fears about, oh my God, I'm getting the flu, I'm going to die tomorrow?
So you asked me to alleviate their fears.
Or at least educate us more about those extreme cases.
Right. So usually my job here is that when we have outbreaks, sometimes we get staph infections or other sorts of outbreaks in the school setting, and the parents are very concerned, is my child going to get this? Or sometimes we're talking about very severe illnesses Again, I referenced the mumps illness, and I try to remind people that you just don't get the mumps if you're sitting, feet away or you're in the same building. So a lot of times I reassure folks. The reason I'm struggling with this, as you've probably seen in the coverage, is that there are times when very healthy individuals, and we've seen a lot of focus on children with no underlying health conditions, developing severe complications and potentially dying as well. So I want to balance that point about reassurance and avoiding panic. Again, the flu virus, we can't stop its spread. It has been around for hundreds of years, and what we try to do is use science, our public health principles, try to limit its spread. What I think is important for people to know is that there's always categories of risk. So we know that with this particular strain, the more severe strain, we're talking about the H3N2, has generally impacted the elderly and the very young. So we've seen the cases of deaths of focus, and I believe the number nationally is 53 right now for children, and many, many more hundreds and thousands of deaths for the elderly. But what's new and surprising is, again, the fact that you can potentially be very healthy, be infected with the flu virus, and have a very rapid deterioration. So, again, the risk factors, but it is possible for very healthy individuals to have those outcomes. So I think what's important is that we simply try to prevent it, and if you do develop those symptoms and signs, to seek care, beginning with your primary care doctor, and if it's the kind of point, again, we're talking about difficulty breathing, difficulty keeping down fluids, then you really do want to go ahead quickly to the ER. We do sometimes hear that people have just waited a little too long, 3-4 days, they're trying to battle at home, they're getting worse, and they're getting worse. And so, pulling that lever and seeking that urgent care when is needed could also be key. The other statistic I saw today about the 53 deaths in children is that only 1 in 5 had been vaccinated. So again, those parents tried to do the right thing for the 20%, but the other 40% had not been vaccinated. So while it may not be 100% effective, there may have been some opportunities either for them or the other elderly or the adult population that have gotten ill for them to have received the vaccine and prevented the illness altogether.
So you're talking about the ERs and how they're getting crowded and all. So it should only be those, like you're saying, if you're having difficult breathing, to go to the ER, correct?
The signs and symptoms are many. If someone has an underlying heart condition, they're on dialysis, they have other sorts of illnesses, COPD, chronic obstructive pulmonary disease, they're smokers, they're going to be at risk of pneumonias and other more serious complications. So I don't want to provide any direct limitations here. I want always people to use their best judgment. It's better to be safe than sorry, let me put it that way. But I have also witnessed, I was visiting one of my friends in the hospital who's undergoing chemotherapy, and I did go ahead and look into the ER and hearing from the ER doc saying there's people that are very healthy, they just, maybe perhaps it was after hours and they couldn't go to their primary care doctor, they're sitting there in the ER waiting to get assessed. And so, something between a primary care doctor's office and ER may be an urgent care. And so I guess what we're trying to say here is try to avoid that if possible, if you have other access, if you have other means, and certainly, use your judgment when it comes to where you need to seek care. But generally, our ERs should be reserved for those who are sickest.
When does flu season typically end, and how long is it going to stick around this year?
Right. So I'm going to give this diagram again of when it ends. It never ends. There's always flu. There's always a few cases, but generally what we see is that it goes down towards the spring months. Mid-April is usually a time, end of March, April, May. So when we talk about the peak of flu seasons, we see that happen at any time between December and February. What we're seeing this year is the peak, the volume. It's not just 1 or 2 weeks. We've been at this peak since pretty much the Christmas holidays. And so I would expect, based on the numbers that we see, we're not going to see a sudden sharp drop in March. This is probably going to continue with us for at least another 6 to 8 weeks. Yes, ma'am.
So when flu season, you said it never really ends, but when it slows down a little, what's next for you and what's next for the health officials in terms of next flu season?
Sure. We certainly try to take any lessons learned. I think one thing we learned in the Office of Public Health is the statewide same-day vaccination campaign was very effective. We're able to get our messages across to the community. I want to thank all the local TV networks, because what you all did is you covered those events, is you allowed our message of prevention to get to all the residents that needed it most. And so it was very effective. And actually, I was on a call with other state health officers for Southeast U.S. all the way up to New Mexico, and I was proudly sharing what we did here in Louisiana. Many of them said, we've done things like that, but I don't think any other state, as far as I know, the ones my colleagues on that call had said they'd done something like this. So one, I'm very proud of our state. I'm very proud of the fact that we have those parish health units that are under our capacity and control and could, really make the provisions needed to drop what they were planning on doing and deliver that service. And two, I think things that we'll do for the future is this was a fairly quick level of planning. I'd love to increase our partnerships with our FQHCs, our fairly qualified healthcare centers, or rural health centers, or other primary care providers that want to join in this fight with us. So what we'll be doing is, again, sharing these same prevention messages next year, ensuring that the availability of the vaccine, we usually stress early in the fall and winter months, and if we have another severe flu season, to continue to do so as we're doing. And with public health, seasonal flu is cyclical. We see it obviously every season. We hope that next year's will be less intense, but every year affords some new learning opportunities. And so through our infectious disease epidemiology program, our ongoing discussions with the hospitals, our infection control preventionists, we listen to their feedback and say, what worked, what didn't work, how was the messaging successful, or how does it need to be different?